made its first division ready. It's called a secondary oocyte. If this sperm cell penetrates through here, then what you're going to have is you're going to have the division of the nucleus of the egg again. So that's why I wanted to show you this picture here to depict that once this sperm cell gets in the doorway here, now that will trigger the egg cell nucleus to divide again, making another polar body, okay, and the actual nucleus. Okay? So you'll have this polar body, and notice if you look at it really closely, this polar body also is dividing again. That's where many books will say you'll have 1, 2, 3 polar bodies and 1 viable egg cell. Some books say polar bodies be 2 or 3 and 1. Basically, your ease of remembering is sperm cells, there's 4 produced that are haploid or 23 chromosomes each one. In the egg cells, oogenesis, which is a type of meiosis, you will have 1 viable egg with nourishment cells around it and 3 polar bodies. That's where you get your form. Okay? Once you have the sperm cell inside here, then the nuclei will fuse. Here's the sperm cell, there's the egg cell. Now when you have the fusion of the nuclei, this is called, not a baby, not an embryo, not a fetus, but a zygote. And how many chromosomes now does this zygote have? 46. Correct. Okay, we're good there. So, with the idea of this development then, you have this occurring. Here you have fertilization. Now as it's going down through the tube here, going into the uterus, you have, there's the egg and sperm. Now here's your zygote. Then you have the first division. From this point on, the process here is called mitosis. Alright, so there's your zygote. Did not divide yet. There's your first division. Mitosis.
So after the first division is when mitosis occurs?
First division, when you have 2 nuclei together, is zygote. When that cell divides the first time, right there, then, so you already have 46, which is a regular old cell, and divide and make 2 cells with 46. So there you have, and see that's a little anaphase there, okay? Then here you have the first division, and that's what I was saying to you, kind of kidding around with 2 bonds and stuff like that last time. Here's this membrane around here. If, now these cells are 2 diploid cells. Diploid means they have 2 end number or 46 chromosomes. If that membrane would kind of break away, then this cell could float over, this cell could be independent, and then when they get down to the uterus, this is still in a fallopian tube, right? When they get down to the uterus, you'd have 2 masses of morula and a separate blastocyst. They would attack separately, and you would have identical twins, okay? So that's what can happen, but usually that membrane stays there, and you divide it 4, 8, 16, 32, keeps on going. Day 1, 2, 3, 4, 5th day, 6th day, then you're going to have here the blastocyst, and that will implant into the uterus. Somewhere, heading to the tree, 3, 4, 5, 6 days. Okay? Once it implants and you start to produce these stem cells here, these stem cells then will burrow into the lining of the uterus, which looks like this. Okay, here's the endometrium. And then these cells start to burrow in. This blastocyst then with the actual penetration into the endometrium. This would be then called the trophoblast. The trophoblast is very important because that is the structure that's going to release a hormone. That hormone is HCG, human chorionic gonadotropin. What does it do? It will tell the corpus luteum, hey, keep doing your job. You're doing a great job. Keep on producing that progesterone. Keep going for a while. How long? That HCG will be in control for about 2 months. Okay? It'll peak very rapidly. Now, it starts to be released when this trophoblast attaches. Give me a day. Right? Well, within like 7, 8, 9, 10 days after what? After conception. Okay? So the trophoblast is attached. You're producing HCG at the time period that would be, hey, the time period where that you have the missing of your first menstrual cycle. Okay? 30-day cycle, day 16, 17 is when you play games, other than golf and tennis. You go 10 days after that, what are you at? You missed your first menstrual cycle, and then you can do your own little peeing on the stick and see if it's positive or negative. That's what you're testing for. You're testing for HCG, not for progesterone. Some people think, well, you test for progesterone because that's when you get pregnant. No, because every month you have a high level of progesterone. But the HCG is going to be released from that trophoblast that will be released that hormone. Question, Danny?
2 questions now. But I think I got it. Where's HCG in the book?
It
I was
is
just
in
trying to
the...
find it, like, to see exactly how
Yeah, he
it
doesn't
goes.
bold face it or anything like that. I don't know why he doesn't, but he doesn't. It is in the chapter on the development there, and it is...
It's on 1107.
What?
It's 1107.
Right there where it talks about implantation, and then it talks about the trophoblast, and then it talks about the HCG. Okay, good.
What was
Okay, the next question.
okay, 3 questions. What was the day range
Day range of
for
what?
when it goes to the trophoblast? Where does that
Well,
fit in?
you have 3 to 6 days to it implants in the uterus, and then that's the blastocyst. So you're talking about 6, 7, 8, 9, 10. You know, so basically after it has implanted, that's when you're going to start releasing the HCG. So very shortly after you have conception, that HCG is going to start to form in your blood. But the level will be low, that it's not going to spill over, that's going to be testable in your urine. That's why if you get over-the-counter type of early pregnancy type test, they want you to have a successful true test, so they're going to tell you to wait that time period when, if you are pregnant, it will definitely be in your urine. But you can test your blood a lot earlier, and get a positive test. But the positive test will come from that trophoblast. Okay? So we got that all taken care of. Now, when we're talking about the idea of spermatogenesis and oogenesis, just to give you a little bit of review, okay, just so you're aware of what this looks like and so forth, okay, you have to realize this. There's a difference in meiosis. That's what I was trying to show you there. Here is the picture of spermatogenesis. I didn't put all 250 million and 500 million up there, but there's a lot up there, okay? So you go through all the rigmarole here, and I want this to look very complicated for you. Oh, that's right. So, what you doing, Ellen? All right, great. Okay, and then as you go down through here, you're going to mature the sperm, and eventually the spermatids are going to get the little tails, and you go from 46 down to 23 chromosomes. That's all I want you to know. You make 2 divisions, boom, boom, and eventually you come up with every testis cell produces 4 viable sperm cells. Okay? Now, sometimes they could have 2 tails, or they kind of stuck together, their 2 heads kind of stick together, something from 2 different sperm cells. That can happen, but every cell in the testes cells and ovary cells have 46 chromosomes. They produce cells by the process of Gnatogenesis, which is a specialized form of meiosis, and oogenesis, that's a special form of meiosis, to produce the sperm and egg cell respectively. Okay? Now, down here is otogonium, right? That's an actual cell of 46 chromosomes. It's going to produce two divisions. Here's your secondary oocyte. When is that formed? It is formed inside the ovary, and that is the designated cell that you ladies release every month. It already went through its first division, and you already have a polar body that was formed. What is a polar body? A polar body is a cell. It's a regular sex cell, but it does not have the extra little layer of nursing type cells for nourishment. Okay? So then your secondary oocyte will come down through the duct. If there's no games being played other than golf and tennis, it just goes down, disintegrates, and it comes out the menses flow. If by chance sperm cells are in the fallopian tube, then the sperm cell will penetrate the outer membrane, then this secondary oocyte will divide again, producing another polar body, and the nucleus, which will have 23 chromosomes in it. This will also have 23. And then, that's the exception. Go ahead, listen.
I just can't seem to wrap my head around these polar bodies, like why we have them, where they come from, what they're.
Well, you have, I don't know. Okay, if you want the biological reason, you have one egg that is much different than a sperm cell. I kid around in lab that the sperm cells are really thoughtful because they take the little bag of energy with them, the little fructose, the little mitochondria that wiggle that tail, right? The egg cell doesn't really need mobility, but it needs nourishment to stay viable in case the sperm cell wants to, so it's going to be there. But your body is not going to waste putting the nourishment to other polar bodies. So, and it's actually a way of making a randomness of genetics. So you make those little Punnett squares, which we can't do because Alyssa breaks out in a rash. She doesn't like Punnett squares. She won't be lab, and that a person had, she almost went around a fucking chocolate. She's always, she just gets really weird. Nerdy and wrong. Yeah. So we don't want to do that. So if you go to those Punnett squares, you have the possibilities. Well, there's genes, chromosomes in those polar bodies, but you just don't select those. So it's more of a randomness of selection.
And there's no, like, they're not weaker, genes.
They're weaker, they're not weaker. No.
Our body
They're just, the polar bodies are weaker because they don't have any nourishment. So they'll never be able to be fertilized to develop memory. Okay? It's just, they're there. Okay? And then the sperm cells then will fertilize the seed. But some of those polar bodies that are hanging around, if they're there, they can even be met by a sperm cell. The sperm cell might be so excited, but it ain't gonna ever happen because it's a shriveled up cell. It's not gonna function as a polar body. Okay? So that way then, there you have again the 23 and 23, and now you have a zygote. Okay? So we're good with that. Now, as far as the idea of meiosis and stuff, if you take a look at just a simple genetics type thing, without Punnett squares, okay? There you have a parent cell with 2 X chromosomes. So you ladies produce, right, X chromosomes. If when you have a sperm cell that's fertilizing them, okay, you will get either an XX or an XY, and then you either have a female offspring or a male offspring. So it's the one time that the male gets a chance to make a decision. Okay, for one time, right? So the male will send out the sperm cells pretty much in equal number because he has an X and a Y. So he pretty well divides his cells and has X amount of X's, X amount of Y's. And then randomly, whatever sperm cell meets that egg, that's why you are the sex you are. if Harry and George are racing to the egg and this one won, and that was X-bearing sperm, you're a female. If this one won, you're a Y-bearing sperm, you're going to be a male. Okay? So basically, and that's how that happens. Sometimes you have problems that the X and Y don't separate. Okay? So you can have the parent and then both X's stay in the egg cell and there's nothing in the other cells. Okay? Now, this would actually be like a Polaroid. Okay? So sometimes you could have this happen that the two X's be in the polar body and nothing will be in the regular egg cell. Well, that's not going to develop. You need an X. Okay? So, what happens is, if you have two X's and an X-bearing sperm fertilize that, you're going to get triple X offspring. Now, those aren't your models or anything. That's a triple X or super female, which is going to be somewhat pretty normal. Sometimes they are infertile, all right? But they may have a little bit of mental problems, but for the most part, they're functional. If you get the egg cell that doesn't have X, but has all the other chromosomes, and it is fertilized by an X-bearing sperm, you're going to have an X and an O zygote, which is called Turner syndrome. In Turner syndrome, what you have is a lot of times a person that's like this, that the female will be very undersized. The female will usually have the breast nipple areas way far apart, all right? And they will usually be sterile. When they're developing as young, you may not notice it except for the fact they will have great big ropey looking neck, like ropiness in their neck. It won't be a smooth neck, but great big muscle rope-like things in their neck, okay? And a lot of times they do have trouble with diseases and stuff, their immune system tends not to be as good. But the reason why they are that way is because there's no X chromosome and an X-bearing sperm cell. Your question might be, okay, suppose you don't have an X and you fertilize by a Y-bearing sperm cell. The cell will disintegrate because you need an X chromosome. So now I have a theory about X and Y chromosomes. See the X's there and the XY? This is just, I haven't published this, so you can't tell anybody. I'm working on this research, but see the two X's there. And see this little leg of the X there? We males don't have that extra leg. And I'm thinking that there is where you ladies have your attitude genes. Because you see, you don't have that. I'm not sure. I'm still working on research, but that's what I'm thinking about. Okay? So, all right. Now, with the X and the Y, here you have the conditions that if you have a Y chromosome present, what's going to happen? You're going to develop the testes, you're going to develop the spermatic cords, and eventually you're going to have the complete system there that's going to develop this stuff here in the pelvis. All right? So here you have, at 7-week-old embryo, you have a Y chromosome present, it's going to develop this way. If the Y chromosome is absent, you have two X's, then you're going to develop the ovaries. There you have the fallopian tubes, and then you're going to eventually develop this structure that will be housed in the pelvis. That's their internal development. Okay? So as you see here, there's the testes, they're about the same location as the ovaries. As the young male develops in utero, shortly before birth, the 8th and a half to 9th month, the testes will descend, the scrotum will already be developed. So when you have the outside genitalia, here you have the development of the pelvic floor, okay? And then you have the tissue there, that if the Y chromosome is present, the tissue starts to grow in this area, which develops into the penis, okay? And then the folding will fold outwardly, as you see here, it's folding outwardly, and eventually will form the scrotum, okay? Then there's your pelvic floor, that's the rectum. if the Y chromosome is absent, then you'll still develop this very large structure that has a lot of nerve endings. That's the clitoris, which will then stop growing as all the rest of the stuff continues to grow, and then you will get the vaginal folds that are fold around the labia major and minor, and then you'll have the vaginal opening there, and then there's your rectum also. And right at that point, right there, that's where you have your urethral opening. So the tube is growing down from the bladder, and it will meet and join with the folds of the vaginal canal. Okay? And you see basically the idea of weeks. This develops at about 10 to 12 weeks. So you go by months, then you're looking at 2.5 to 3 months. So a 3-month-old embryo is now a fetus. It's called a fetus after 2 months. You have an individual that you could put in the cap of one of your highlighters. About that big. And you now could determine the external actual genitalia of the offspring if you have an ultrasound. If you have a CBS at 2 months, you can determine that because the karyotype you see next to the Y chromosome. So next to next. Okay? That's basically development. All right? So basically now we're all caught up. And the one thing I want to talk to you about that was kind of a little bit misleading with the textbook picture is the actual development of the circulation system of the fetus. I found a better chart to show you this, and here you have the placenta, okay, and you have 2 arteries and 1 vein, okay, and I kind of colored them here to show you what basically is happening. The vein and arteries are the definitions you learned in your cardiovascular unit. The vein here is carrying blood towards the heart, but it is oxygenated from the oxygen being exchanged in the placenta. So that's larger thing there. And your book kind of shows it going around the liver. It actually goes through the liver and picks up the vena cava coming up into the heart. It will actually branch and go into the vena cava. Okay? Then it goes in the heart. The heart blood will mix. That's why I did that little diddly there with the different colors. It's going to actually mix because there's no division between the 2 atria. And then it gets pumped around the fetus's body. So the fetus's blood carries the oxygen nutrients that get diffused across the placenta. Mom's blood does not go into the baby. Baby's blood does not go into the mother. Okay? The placenta is the basis where things exchange there, never go into the different systems. Now, as it's coming out of the heart, it's going to all different organs, right? Notice down here, somewhere in the bottom of the descending aorta, okay? There you're going to have these branches that grow into the umbilical cord from the fetus. And those are your arteries. Why? Because they're carrying blood away from the fetus's heart. Don't even worry about mom's heart. Mom's heart isn't even pictured here. All you guys are placenta. Mom's over here. Can't even see her. So the arteries are going to carry blood, which is now somewhat deoxygenated, back to the placenta to pick up more oxygen. Okay? Fetal hemoglobin can carry more efficiently oxygen than your adult hemoglobin. Okay? It's very, very effective at carrying oxygen. And again, the fetus doesn't need a lot of oxygenated blood because it's not going out dancing, running marathons, or doing all kinds of fancy activities. It's just mostly existing. Okay? Go on, you have a question?
Yeah, I must have missed something.
Go ahead.
The placenta is where the fetus is. Right?
Placenta?
Yeah.
No, the placenta. This is the fetus. This is a
Okay.
glowing view of what the heart circulatory system of the fetus looks like.
Got it. I got
Okay?
it.
Then here's mom. Mom's over here. Yeah, mom's over here. Okay?
So the baby's blood never goes mixes with
placenta is a membrane that the stuff comes into. Here, the umbilical cord comes into here. This is the placenta. Mom's over here. Mom, right here, would be mom's endometrium. Okay? This placenta kind of grows out from that. A little spongy. Okay? And then this placenta will exchange in the little villi of the placenta. You'll have like mom's blood here, baby's blood here, and then in between there, they'll change glucose, oxygen, carbon dioxide, all kind of nutrients, drugs, viruses, right? All that kind of stuff will pass across the placental wall. Okay? All right? Everybody good there? All right. So, now that we have this embryo, we're going to start talking about the development of this embryo. Okay? So, when you have fertilization, and we talk about the different things going on, here is a artist concept of what this thing looks like as it's being developed in the first couple weeks of uterine life. This would be maybe the first 10, 15 days after conception, right? We're not after ovulation, after conception, so like 2 days down the path, okay? So here you have all the villi, okay? And what this is showing you is here's your yolk sac. And remember, yolk sac is used for producing red blood cells, not for nourishment, okay? And your book talks about different layers, the ectoderm, mesoderm, and the endoderm. Those are just different, we call them germ layers, okay? But basically what they are is how your embryo disc here will actually develop these different areas. So here is the skin area and the outer ectoderm, which is your nervous system and skin and so forth. Here is your muscle tissue, some of your internal organs. Here's more of your internal organs. So it's different like the process of building your embryo. So I just want to make you aware that when we talk about these different germ layers, right, your language medicine also talks about this, they talk about these germ layers. It's just a way of seeing how they develop from what type of stem cells. Okay? Not a big technical type item. Okay? You do notice here that this area all around here now is encasing the whole development process here. So when you have this extra fluid around the outside of the development here, that's the amniotic fluid. Then you have all the developing tissue in here. Then you have the chorion. Now you're probably going to laugh at my analogy, but this is kind of like a cream-filled donut. Take a cream-filled donut and put a little pea or a marble in the middle of the cream filling. The outside donut part is the chorion. So if you would actually see this thing, what it looked like if you could actually look into a uterus on a less than 1 month old developing thing, you'd see that a little bit like a giant like pimple sticking out of the endometrium. That is burrowed into the endometrium, the villus of the endometrium. So that is a little ball of chorion cells. Now, all this stuff pictured here develops out of the fertilized egg. All mom provides is the endometrium, the wall, right? And I'm going to grow everything out from there from the fertilized egg, okay? So the chorion would be like your outer donut part. The cream filling part would be like your amniotic sac. And then the actual little marble would be the actual developing embryo deep inside the amniotic sac. Okay? So as your embryo grows into a fetus, it's going to start pushing this stuff away. And you're going to get pictures that are going to show you like the embryo starting to form, and then you're going to see this like sac-like thing that it's actually in. So here you have pictures of the very early development within the first 2 weeks or so of embryo life. Okay? So here's your first 3 weeks. A Then B, 3.5 weeks. Here's about 4 weeks. Beautiful baby. Beautiful. Okay, there it is. Okay. Now, how big is this? We have that embryo lollipop in lab. Okay? That big model is this big. A little point of your pen sticking out there. That's how big you are at 1 month. Okay? This is what you look like. See that big bulby thing here? That's your liver and the heart developing. Okay? 21 days after conception, a bunch of cells start to quiver. Those are your heart cells. That's you're going to fold and make a heart. Okay? So, here you're developing your backbone. There you have your cerebrum starting to form. Okay? And here, this is an embryo, about 4 weeks, about this big. Alright? You see little arm buds and a little bit of feet buds here. The artist concept picture, you can see a little better here. There you are. The actual size right here. There you go. See it? There you are. That's your actual size. Okay? So there you what you look like. Here's your little folds that are actually called pharyngeal clefts or pharyngeal pouches. It resembles like little gills like you have from your ancestry animal group. There's your little leg buds, arm buds. There you can see at 5 weeks. Here's 6 weeks. Here's 7 weeks. Okay? Now, here's your metal pencil and eraser card. You're at 7 weeks, just about that size. Maybe a hair small at 8 weeks, you'll be about that size. That's how big you are at 2 months. We have 7 more months to go. You get about 18 inches. Right? You're going to grow like crazy. Okay? There you can see the picture of the development there. Here's your placenta. There's your stalk, the amniotic sac around. Here's your umbilical cord. There you can see the eye making a development there. That's exactly retina, kind of goes outside in, right, from inside out. And then very shortly in the 2nd, 3rd month, you're going to get the eyelids forming. So it'll be closed for most of the time in your uterine life. There you see little blood vessels going to the brain. Look at that. You have this with a big space here. Well, you didn't catch up. Your cerebrum something catch up yet. Okay? So this fetus could not be tap dancing or soccer like that. Formation. Okay? So there you go. Okay? Down here's your ear. It didn't get to where it's supposed to be yet. Okay? But see this? There it is. Down here's your ear. So your ear has to move up to here. Okay? All right. So basically then, here's your development. Okay? As you work down through here, and then when you get to the 2-month stage, how many days would that be? About 60? Well, here you are at 56. Okay? So you're just about there. Notice at 2 months, you have little fingers. This is about 1.5. Here you have 2 months. There you have little toes. Ones that probably wiggle all home and roast beef and stuff. And here's your digits. Your eye is pretty well where it's supposed to be. Your ear is just about where it's supposed to be. Notice how much bigger the head is than the rest of the body. Because you're developing. The 2 systems that develop first are your nervous and circulatory. Those are the 2 systems that develop first. And then by this time, all of your organs are pretty well developed. They're not functioning yet, but they're pretty well developed. Back here, you see this red bulbous type liver there in your chest cavity. Right now, that is cranking out a lot of red blood cells because your yolk sac is pretty well disintegrated now. It kind of goes away and reforms and goes away. And then by that time, your liver is functioning to make your red blood cells. And then at 3.5 to 4 weeks of uterine life, that's when you start making your solid bones, and then you're going to have your bone marrow that will start to make your red blood cells. Okay? So basically then, that is your development. Now, where are we at in the book? We are at the book stage where you are looking at the major stages of prenatal development. Okay? On page 1106, there's your zygote, morula, blastocyst, then you have your embryonic stage up to 8 weeks, your fetal stage from 8 to 38 weeks. We then talked about the implantation of the trophoblast, the HCG, okay? Twinning you can read for yourself. There's a artist concept of 1108. Make sure you read about the ectopic pregnancy, okay? And then we're talking about the embryo development there from pages 11, 12. There's a very, very vivid picture of the placenta. And incidentally, when you are in the OBGYN rotation, you may have a very, very important job. In the delivery room, there is a nurse that her sole job is to get the placenta, have a little dish there, take it and make sure, examine it, to make sure all of it is there. Okay? Because if any of that would be left inside, there's a very not good outcome. The woman can get very, very sick and can even die from that. Right? So to make sure all the placenta is delivered. Usually it is. Because after the birth, the mommy can tell me better than I can tell it. After the child is born, it's okay, give it a little more push. And it's, oh, there'll be another one in there, right? But then give it a little push, and then poof, out comes the placenta with the embryonic, and look forward to it, and then they'll examine it to make sure it is all there. Okay? Very, very important. Okay? Then, over on page 1115, they talk about the fetal circulation. All right? Do not worry about neonatal circulation. What they're showing you there is, yes, your little hole in the heart will close up. Instead of a foramen ovale, it will now be a fossa ovalis. Keep this in mind, so when you get to your OBGYN stuff, you go back to your book and refer to it, but that will close up very shortly before birth or at birth. Right? Now, if that is not closed up, then they used to call it a blue baby will be born. When the baby is born, as the baby is born, and maybe you mommy did get a chance to see this because you're really tough working hard to get the baby out. But if you're observing, you'll see the baby, they'll try to get it to start to cry, get it to breathe. As the baby starts crying and breathing, because why they're crying? Well, they're going from about a little over 100 degrees inside mom to a living room about what, 65? So that if you'd have to jump in the water like that in the swimming pool in the summertime, you never do it. That much difference in temperature. That's why they're probably crying their head off, right? That's a good thing, because you're going to inflate those lungs, and then you actually see them start to get pink. The whole body will start to get the pink color. If they don't necessarily pink up like that, it may be because that is not closed, right? Now, what's really interesting is years ago, they had to operate, go in and operate on a newborn to get that closed up. Now, they just put a catheter in, down there, fish up through, and put a balloon thing in there, it'll heal up and good to go. It's going to be an invasive surgery. Okay? So just look at the fetal circulation. Make sure you understand about why there's two arteries, one vein, where the blood is going to and coming from. Do not worry about the neonatal. Okay? And then the rest of the chapter shows you pictures of the development. There on page 1117, you see an 8-week-old fetus, right? Actually, the embryo there, starting third month would be the 9th week, would be actually called the fetus then. There you can see the amniotic sac, okay, the chorion, okay? And I gave you a sheet that talks about the development. I thought this sheet was kind of very, very easy to follow, okay? And basically, it goes by weeks. If you look at the first weeks to 9 weeks, everybody have one? 12 weeks. 12 weeks is how many months? 3. That's the first trimester. Then you go 13. How many more weeks do you get the second trimester? 20. Okay? Second trimester. And you have your third trimester. Okay? Now, you do not memorize all that stuff. The first 8 weeks, end of the embryonic period, that's important. Now, one is called embryo, now it's called a fetus. You have the limb development, cardiovascular system fully functional at the end of 8 weeks. It means you're starting to pump the blood. Where's the blood being made? Yolk sac and now the liver. Okay? All body systems present in at least rudimentary form. Okay? don't worry about the length. I'm never going to ask you the length of the fetus. But I think you would try to remember, I think it's like a wow thing enough, that's the first month, and your pencil is the second month. You erase that, and you mark that one out. Okay. The 9 and 12 weeks, all right, which is basically your third month. The head is still dominant, but you saw. The skin epidermis and dermis is very obvious. You start to develop your nail. Liver prominent. And now, at the end of this, at your third month, you're developing blood from the bone marrow, because now you're starting to produce your actual bone cells. And you can determine the sex. Okay. So your head is still enlarged, pretty dominant. You're forming skin. Liver is functioning. You are now forming blood with your bone marrow rather than liver, and you can determine the sex. Second trimester, starting the 4th, 5th, and 6th months. Now you're going to start developing the rest of the brain. You're going to develop your palate. So if you have a cleft palate situation, that's when it happens, that doesn't close. The cleft palate, because you're growing in halves, the palate does not close. If you kind of run your tongue up around your roof and mouth, you kind of feel a little bit of bridge there. You actually grow in halves. So if something is going wrong with the instruction and you don't close this in, you have a cleft palate, which is a problem for the baby. Why? Can't suck. Can't eat very well. Okay, yes, that's a major problem. Okay, so that happened. Most bones now distinct, and you actually start to form your joint capsules. But remember, your joints form and your long bones grow into the joints. Remember that? Okay? So that's a big area for growth of bones. Okay? And at that point there, it doesn't really say here, but that's when you start to really start maybe feeling the baby moving, the fetus. You actually, in the first trimester, probably not, it's not that big, but once you get the 5th and 6th months, right, moms, you start to actually be able to feel something there. I don't know what it feels like in that situation, but yeah, you start to feel that, in the second trimester. Right? By the end of that trimester, 6th month, that fetus is now pretty big. That you would definitely maybe get kicked in a bladder. It's not a very pleasant thing. All right? Definitely if you're waking up in the middle of the night. Okay? Now, this is the point that if you would have a premature birth, you'd have a very good chance of survival with our techniques these days of the NICU and stuff like that. All right? The biggest problem is your lungs will not have that surfactant. Remember that? That slipperiness that will cause the lungs to be able to collapse and expand again, won't stick together. You don't really have that yet. So sometimes there's very much of a risk for that. But you want to get at least to the 5.5 to 6 month time period if you're having a difficult labor. And if you have to deliver the baby, they have a good shot at delivering it and keeping it alive. Then you're 21 to, let's go right down to 30, not the last part there, but the first of the third trimester, you have substantial increase in weight. You have the myelinization occurring now. Your eyes are now open. Your inside of your eye has been developed. So now the eyelids can be open. You will definitely have the blood formation in the bone marrow that you can produce lots of blood. And the liver still helps out for a while, but now the liver is pretty well taking the back seat. And you will definitely have a good shot to survive now 6, 7, 8 months, because right there it says in the first sentence, the lung production of surfactants are immature, but at least you're starting to produce it. So the longer you wait into the 7th and 8th months, you have a better chance of the surfactant being there. 6 months, maybe not. Sometimes it is there, but definitely by the end of the 8th month, your surfactant is in your lungs. Last month, last month basically, there's where your testes will descend into the scrotum. Your skin develops this nice, soft layer, okay? And you will definitely put on a little bit of subcutaneous adipose. Why? Well, you can't be guaranteed mom's going to feed you right away, so you're going to make sure you have a little bit of reserve there. But the baby loses a lot of weight that first 2 weeks. Right? To get established and get growth. See, because you try to stop and think about this. When you're in there as a fetus, it's a wonderful world. You're constantly getting fed. It's just like constant, right? Because all the food, glucose coming in through that, you know, placenta coming through that umbilical cord, it's warm, you don't have a lot of breathing, it's great, okay? Everything just, all of a sudden then, this smooth muscle goes, pushes you out there, it's cold, you didn't get any food, lets you scream your full head off for it, right? And somebody has to change your diaper because you're pooping now, it's a really heck of a thing, okay? No, seriously, if you as an adult would have to go through like one of those survival things on TV, as strenuous as birth, you'd probably say, forget about it, it's too hard. It's really tough. Okay? Now, look over this so you know basically what is going on in different months. Right? Okay. Now, I'll tell you the story. I will give you this as a kind of a jokey study guide. When I taught in high school, one year way back in like 78, 79, 80, way back when, 19, not 18, 78 or 79. I was given a test on reproduction development, and that was before actually they had book bags. And they used to pile books up on the desk, so it's kind of inconvenient to walk by here, but I used to still go around and say, you have any trouble, got any questions? Okay, I would go around the desk. So I went to this one girl, and she had all her books stacked up alongside her, and on top was this paper. And it had the Battle of Leningrad. Huh, is that your term paper? Because that time at Ole, we had a course called German History. She said, yeah. So I'm, no, curious. Okay, so I started reading Battle of Leningrad. On May 5th and 6th, Hitler implanted the troops. During the second week, Hitler sacked the troops for the second time. The core of Hitler's army developed on the 21st day along with the heartbeat of the army. The fourth week, the soldiers were wounded, losing their limbs. Fifth and sixth week, General Y.K. Liver disintegrates. Yolk sac disintegrates and you have liver. During the eighth week, paddles were used to beat grimy uniforms. The eighth week, you don't have paddles. Right? During the third month of the Battle of Leningrad, both men and women were executed. The third month, you know, the sex of the baby. Bones of the fourth month then became brittle due to lack of nutrition, so they have to like princes and put. Stalin damaged the right side of his face, causing difficulty in his eyes and ears. So your eyes and ears are the right place in the fourth month. During the fifth month of the battle, and she had a parenthesis, vernix caseoso, the men acquire long hair. The vernix caseoso is the cheesy material that you get in your like eyebrows and stuff, and a baby, when they're a term baby, that help protect and keep the skin moistened because we're in an aquatic environment. During the seventh month, men's nerves are shot. By the time you have seventh month, your nervous system is really working. You're kicking and carrying because you're developing your nervous system. Right? On the 8th, 9th month of battle, men's skin became smooth because of the weather. On the 8th, 9th month, you put on a nice layer of smooth skin, and you've got baby skin and so forth. After the war, men developed quite full on weight. So I said, this is really something. You get a 0. And, so I kept it. That's actually the original thing. I used to copy that, but then I had some people say, I can't read that really well. So they typed it.
Well, she should have gotten some points if you used her work for 20 years now.
Yeah, that's what she wrote. This is actually what she wrote. She said,
That was in
this is just nicely typed, because I used to copy that. It was hard to read. Somebody typed it up for me. Right? And then she went away, and what did she become? A nurse.
Oh.
Okay, so I'll just give you this lab. It's just kind of a neat little thing. Battle of Leningrad, you know, and that's how she was. Huh?
Ellen, you know you're gonna make one.
No,
Well, there.
Huh?
I don't know how.
You get a zero.
Oh, no, see, the thing is, when you're in high school, you can't play fair. You gotta be able to know when to hold them, when to fold them, like Kenny Robbins, right? So some things you have to do, because that way there, if you get caught cheating, you have to be very, very, yeah, same as the top for a book. That's the text, yeah. Not paper at the top, yeah. But you had a book stacked up, this is laying on top of the book. So I was going around saying, you have any questions? Any problem with the test? And I said, oh, well, what's this, your term paper? She said, yeah. And I just started reading it.
Oh, so she was trying to act like it was for something else.
No, so, yeah.
So what did you do?
Huh?
What did you do?
I said, this is really fantastic, you get a zero. And I kept it.
Was it fun class?
Huh? No, she's a good student.
Does she know you still use it, or?
I don't think so. If I ever see her, I would tell her. She's probably about 47, 8, 9 years old now. Yeah. But see, a lot of things like that, but see, you have to really kind of nip things in the bud when you're in high school, because you have to know when to hold and when to fold. Because if you find somebody cheating, you can't expect the administration to back you up. So you got to keep the source. You can't throw it away. You got to keep it, right? Even the fact that there's two more come around. You got to keep that, because the parents are going to say, my daughter would never do that. Oh, I hear it. Here it is. All right. So. Another thing we have to review, because it might be on the final. Okay? Here's a male and a female, and obviously they play games other than golf and tennis. And will this female have to have any special care?
Yes.
Yes, you will. What will she have to have? Rogam. Right? Rogam. And again, see, I didn't say what birth it was. Right? In fact, I think I won't do that next year. I won't say about, it won't really matter for the first birth. However, you still will get it. Just won't say it. Right? You get it right from the very start if you are negative. In fact, they don't even care what your husband or the person that you were playing games of golf and tennis with, what their RE factor is. If you're negative, they will give you Rogam, because they don't really know for sure what factor could be in there. Okay? So, this is what happens. If the anti-Rh positive antibodies start to form, now when would they form? They would form after the first birth. Now, I think Elizabeth asked about the blood supplies never match. Right, they don't. But when this thing pulls apart, something pulls away from the endometrium, you're going to have some blood exchanging here. And in that blood, if the fetus has a positive factor, then that would get into the mother's body. Immediately, the mother's body will set up antibodies, and it goes through that immune system of remembering. Okay? They will stay in her body, and then when she would get pregnant again, and the fetus would be positive, there's not a very tight a junction here after the first pregnancy. So there's possibility that some of these factors would get into the mother's body. If that's the case, the antibodies will cross the placenta, go into the fetus, and cause damage to the fetus. You say, really? Something about it. Remember the natural passive immunity that mom will give her antibodies to the fetus? So yes, antibody proteins can pass through the placenta. Yes?
What damage exactly would it do?
It will cause damage with the blood system mostly, and it can lead to problems and snowballing into nerve damage and kidney damage and so forth. Erythroblastoma fetalis is a big fancy word for damaging the fetus.
How long is this whole process been around, like where they started giving Rogaine?
I don't quote me on this, I think the middle 60s, early 60s.
Okay,
Yeah, before that, they didn't realize this. So there were some real problems with people because of that. Yeah. Okay, questions? We're good with that. So see, something like that could possibly be on the final exam. That would be from this group, blood chapter, immune chapter, okay? So that's why AP2 is like, well, cumulative. But again, it's going to be a very simple type answer and question. Why are you guys using your trophy or cranial nerve blood? Rolling your eyeball around like that, okay? Yeah. Simple things like this, right? So I wouldn't ask you what the erythroblastosis fetalis is. I wouldn't ask that word. What I would say, this person has Rh positive. She is pregnant. Okay? Would she need to have Rogaine? I could have A or B, yes or no. Or I could say, this person is Rh positive. What will be her treatment? One, she will need Rogaine after her first pregnancy. She will need Rogaine right away, and every time she is pregnant. She will not need Rogaine at all. Check to see what her husband's blood type and ask him. C. It's in your chapter, in the blood chapter. Yes, sir.
Will there be a disproportionate number of reproduction and development questions?
Actually, most of the specific reproduction and development questions that you would normally have, like in quiz 9, like next time you'd be meeting, will be covered in the lab practical. So the stuff we'll go over here, for example, the Morula, right? That would be a classic question. I would ask you the 25 questions that would have, I say, another quiz, right? Well, that would be, there's a model, a whole bunch of cells, that's a Morula, right? So there's stuff like this, the prostate, right? The gland that secretes the alkaline material in the semen would be, that will be covered in lab practice. Now, some of that, yes, there'll be a couple of those general questions in the 150 questions for the final, but there won't be like 25 of those very specific questions out of the 150. I don't want to generally cover it, so thank you very much for the appreciation. Okay? All right?
And the lab is, well, how many questions, 100?
100. So 250 points possible yet. I think that really boost your grade, and that's what I want you to do. Right? Okay. So the idea of genetics, we will finish up with a little bit of genetics on the Tuesday. Then we'll switch over to meet the system type of thing. Okay? On Tuesday.
Is that already been, to meet the system?
Yeah, meet the systems and reviews, yeah. So your real important homework for next week is probably your most important week of the semester. Because you really want to get yourself sitting down with those papers I gave you. It's okay. Yeah, I know that. Well, I'm living out for one time. I don't know anything about that thing here. Yeah, and then get what you need to know is the general stuff. And then to meet the systems more specifically in each chapter, what you really should hone in on and what you should know about each chapter.
And that's for the lab and for both things, right?
Yeah, the lab paper I gave you, notice it's light at the top and dark at the bottom. The dark is really the major emphasis of the lab practice. The lighter stuff at the top, like the endocrine system stuff, you're not going to have to tell me different glands of that, but some of that stuff you might have to review because that deals with like aldosterone and hypothalamus, pituitary, so you may have to go back and refer to some of that. So I put those there just so you know that you may have to go back and look at some of that stuff to help support what the darker stuff at the bottom is. That's where most all the questions come from, the darker stuff at the bottom. Okay. Questions there? Everybody's good with that? Okay, so basically then, we are finished with reproduction, and the only thing we're going to talk about on Tuesday is a little bit of genetics, as far as, okay, how, we talked already about the disjunction of the different chromosomes sticking together. We're going to talk a little more about the Down syndrome. We're going to talk about how do you get certain traits, like for example, we're going to review your blood type. How do you get that with the Punnett squares, right? And just to get an idea of, okay, how do you get these different traits? How does mom and pop give you these traits, and what is decided by dominant recessiveness and stuff like that? That'll be about the first 15 minutes. And from then on, and Thursday of next week, will be in this room, meet the system type of stuff. Okay? Now, Tuesday, we're going to start that. If you want me to specifically go over some type of process, procedure, stuff like that, when you're looking over this stuff for Tuesday, make a note of that and say, hey, can you specifically go over this, that, and that method or process on Thursday? I'm glad to do that. So you give me homework so that I can prepare what you want to see us go over specifically on Thursday. Yes?
Tuesday, is it like the last time Tuesday only is allowed to go Tuesday, but we only allowed to go Thursday next week?
I would prefer that, because that way, if too many people come one night, I can't get around all of the people. I mean, you can kind of go on your own, but I don't want people tying me up that Thursday's group would come and I have like 10 people from Thursday's group there on Tuesday, and Tuesday's group said, well, you're talking to them, but hey, what about me? And so make it fair for everybody. Because they got a castle, I work it out, but if you want to come and do it, I'm here Monday night, Tuesday night, Wednesday night, Thursday night. Next week. Usually 3:45 latest, I get here. So anytime you're here, like if you have nutrition, you're going to come here at 3:30, 4 or 4, working lab stuff, to your nutrition class at 4 or 5, whatever, I'll be there. I'll be there.
So you'll be there Wednesday at 3?
Actually, Wednesday I'm here at 1:30, coming after lab. Again, I'll be doing AMP1 stuff, so you can back there and play with the reproductive models, or play with the development models, or play with the liver, or play with the liver, right? And even if you want to, you have to get out of cats, because they eat all the cats. There's going to be a couple of there that could have a little bit of trouble. Oh my God, they're so good. There'll be some pins in the cat because of digestion that I might put a pin, let's say, in the one, and say what two enzymes are deposited here from pancreas. Or I put a pin in pancreas, say, name an enzyme for each food group that the pancreas does. Proteins, fats, and carbohydrates. So I will use the cat that way. There won't be a lot of pins. There won't be any identification of digestive structure. I put a pin in the stomach and say, what two enzymes are released here? If you don't know the stomach, that's your tongue. You should be able to tell me. I'll say, what is this organ? Kidney, I can ask kidney. I can ask ureter. I ask urethra in the cat. But also I use the model. So it's going to be very heavily model-oriented for a human. I'd be, I'd say, 5, 6, way less than 10 questions on a cat. Why only one cat? Those will be models, pictures of things from what worked. Again, when you have your lab review, Tuesday and Thursday next week, you say, okay, I want you to tell me exactly what I need to know for this. Okay, here's the cat, here's the kidney, here's your, okay, tell me exactly what, give me some questions, what I'm going to do. You're go over here, Donnie. Any questions? Seriously, guys, I want you to do well. All right, so please prepare yourself well. That way you don't really have to do a whole lot Wednesday night. You just to kind of relax a little bit and just go over a couple little object stuff and you should be in good shape. There's a lot of points. You want to hit that lab practical really good. That way you have a little cushion for your final. You don't want to have to do that final exam on Thursday having to get a 78 or you won't pass. You don't want that. Okay? Everybody, you know, like I said, I will be finishing up the reports. The quiz grades are in the computer system, but they won't be actually showing up until next day, which is tomorrow. I'll finish up all your reports this weekend, and then I will put them in on Tuesday so that they will be in there, that you can see what your actual grade is. In fact, I want you to look at your grade. If you have trouble getting to see what your grade is, please see me. I will go over your grade with you. I want you to make sure your grade is correct. You know what it is before you go into your lab and final exam. Okay? Those of you that have extra quiz points, some of you still have quiz points because you had the bonus right plus you had all right. I'm still waiting to get them in. I still have a book I'm putting in. I put a couple in this time because some of you guys actually have one or two wrong for a change, right? So I still have those extra points recorded. I'm figuring that maybe you might miss some in the lab practical or the final exam. So you will eventually, unless you get hundreds of those, you eventually will be able to use those points somewhere along the line. Okay? Because see, I go on total points. So see, when I add those points, it doesn't add a percentage, it just adds a point. What's the matter? So you have 75 right out of 100 on your lab practical, and you have two 27s, so I'll put 27, 27, 27. I'll put those 4 points on there, and I have 29 out of 100. Total amount. I'll just record that grade in the computer, which then will be a percent. Okay? Very good. We'll start lab. Leave it early, maybe about 20 up. Or so. Any questions, please let me know. Yes, lab. The lab Thursday's group has to go first because it's a Tuesday lab practical, and see, Thursday doesn't have to stay after 6:30, so they have to go first to make it fair to them because they're not usually have to go late on a Tuesday. So Thursday's group will go first at 5 o'clock, and then by 6:15, the blood will all be dried up so the other group can have a dried blood spot.
Oh, God.